I spent 7 months as an involuntary patient in hospital, and it was quite traumatic. I was assaulted on 3 occasions and I had ECT. So when I got out, there wasn't a lot of the old me still left. I had no confidence. So when I started treatment at a community mental health clinic, I did what I did in hospital, which was I nodded and I smiled and I pretended that I understood. So my psychiatrist said for my bipolar disorder, the gold standard medication was lithium. Okay? He rattled off a list of side effects and I just kind of nodded. And then he said, lithium can be dangerous. I had to have regular blood tests because if the lithium levels in my system got too high or too low, then there'd be major health problems. Oh, all right. And he gave me my lithium medication fact sheet, which I put in the filing cabinet at home. Fast forward 2 years and I've got thyroid damage. And in parallel with that, of course, I developed an eating disorder because I was starving myself because I had a thyroid that didn't work. And then a year after that, I had kidney damage. Now, when I say damage, I don't mean that I Googled it. I mean, I went to the GP, I had tests, I was sent to a specialist, I had more tests, I saw another specialist. Then I got a new psychiatrist, which happens every 6 months to 18 months at a community mental health clinic. And the first thing she did was give me a complete, detailed physical health check and quiz me about side effects. Then she leapt forward excitedly and said, "So what have you heard about lamotrigine?" And I went, "Nothing." And it turns out it's a relatively recent medication which has none of the Goldilocks problem of lithium and no organ damage. So that was the first shock. There was a viable, effective, safer alternative. And for me, it works just fine. But the second shock was her assumption that I would be researching my own mental health problems and my treatment and my medications. And I left her office going, of course that's what I should be doing.